They use fish oil to unlock autistic children? Functional medicine. Definitionally, functional medicine practitioners will tell you they take a comprehensive, holistic view of health that searches for the root causes of disease, whereas Western medical practitioners only treat symptoms. So right away, you're being marketed to. The idea that medical doctors don't search for root causes is just bullshit. There are good doctors and bad doctors and everything in between, but the idea that the entire system is compromised in such a way tells you more about the advertising efforts by alternative medicine practitioners. Functional medicine practitioners have to talk like that in order to avoid talking about the fact that they're not really engaged in a form of medicine. There are 24 official boards that certify specialists. None of them certify in functional medicine, but someone does. The term functional medicine was invented in 1991 by a chemist named Jeffrey Bland as part of one of his companies. And this guy sells a lot of books and memberships and courses and supplements. Functional medicine certifiers advertise it as a new paradigm of healing that considers genetics and the microbiome and physics. People like Mark Hyman, who is now kind of the don of functional medicine, says things like, functional medicine is a fundamental shift that approaches the body systemically and without the arbitrary divisions of conventional medicine. Yeah, sounds great, but he also talks about things like epigenetics and quantum physics and nutrition when he's a family physician, which is cool. But am I going to trust the guy who wrote the foreword to RFK Jr.'s 2014 book about thimerosal and vaccines, when thimerosal was mostly removed from vaccines in the late 90s, and there has never been any proof of the vaccine autism connection? Or a guy who champions low-carb diets? Oh, but GQ just published a puff piece about his abs, so at the very least, Hyman is actually a doctor. You don't need to be one in order to call yourself functional. Homeopathists, chiropractors, and naturopaths can all call themselves functional, and it doesn't really matter because Jeffrey Bland just made the shit up. I mean, there are certification programs, but they're run by people like Mark Hyman and Jeffrey Bland. There are 6 modules in their course. One is detoxing, which is just bullshit, as we know. And the other is energy, which kind of could mean anything that they want it to mean. I looked at the faculty for the training and I didn't see any physicists, but I did notice the $17,000 certification fee. I asked surgical oncologist David Gorski what the real dangers of functional medicine are. Here's what he told me. Functional medicine fetishizes biochemical individuality of patients above all else, which sounds good but basically serves as a get-out-of-jail-free card to justify all manner of quackery. Functional medicine doctors routinely order batteries of tests, some of which will be abnormal by random chance alone when such a large number of tests are ordered, and then correct every abnormality, often using non-evidence-based treatments. They also treat fake diagnoses like adrenal fatigue, often based on imbalances in hormones, mind-body, and detoxification that sound a lot like the Four Humors. Finally, one huge problem is that while many functional medicine practitioners are naturopaths and chiropractors, a significant number are actual physicians with academic affiliations. The medical literature isn't much help in evaluating functional medicine because proponents have never bothered to set forth their individualized, patient-centered, science-based approach in any forum where actual scientists could evaluate it or lay down any sort of concrete guidelines that other physicians can follow and test. And so what do you get with functional medicine? Probiotics to replace gut flora, only helpful if you're deficient. Parasite cleanses, bullshit. IV vitamin infusions, more bullshit. Fish oil to unlock autistic children. I wish I was kidding. Diet and supplements recommendations for leaky gut. Not a thing. Don't take my word for it. Mark Hyman's Cleveland Clinic actually calls leaky gut hypothetical. And yet on the very same webpage is a list of solutions for that hypothetical condition. As I said, there are great doctors and there are shit doctors in the Western medical system. There are well-meaning chiropractors and naturopaths. I can't imagine anyone involved in healing wouldn't want to get to the root cause of disease, and yet in every profession there are charlatans. I understand that people suffering from chronic disease are desperate, but to market made-up medicine and tests while decrying an entire field of medicine as only treating symptoms is just gross and unfair to the countless doctors and researchers doing amazing work, especially here in America where we have to live in this fucked up healthcare system. But a functional dentist talking about cardiovascular and Alzheimer's disease while waxing poetic about the gut biome? Well, that's just outside of your scope of practice. I know how badly these people want to be shamans and cure everything. It is ludicrous that dental and eye care require different forms of insurance in America, as if what happens in our eyes and our mouth don't affect the rest of our bodies. But there are benefits to specialization. If I go to a doctor, I don't want them talking about quantum physics when my stomach is bothering me. And I certainly don't want to be sold a battery of tests so that I could be sold a cupboard full of supplements that have never been tested for anything. You can identify and combat the very real problems with our medical system and our government's inability to better regulate pharmaceutical and insurance companies. That's engaging with the very real process of civics, but that wouldn't make you very much money. There it is.